übergeben. Francine Brogyanyi ist Healthcare-Expertin hier bei DORDA, Rechtsanwälte, die uns auch bei der Vereinsgründung unterstützt haben. Herzlichen Dank, Francine. Und wird uns jetzt ein bisschen was über die Rechtslage im Gesundheitsbereich ein bisschen was erzählen und dann auch gerne ein paar Fragen beantworten. Francine, herzlichen Dank und danke, dass wir auch hier sein dürfen. Danke.
Ein paar einleitende Worte auf Deutsch und dann switche ich auf Englisch, wie gewünscht. Ja. Ja, also wie schon so nicht angekündigt von St. Paulin, ich bin Partnerin hier bei DORDA und leite die Health and Life Science Industriegruppe hier bei uns, mache das seit 15 Jahren, beschäftige mich also nur mit dem gesamten Gesundheitsbereich, von Krankenhäusern über Biotech, Startups, E-Health bis zu Big Pharma und alles dazwischen. Dementsprechend habe ich auch das Thema für diese Keynote gewählt, Trends in the Life Science Sector, sehr weit gedacht. So I'll switch to English now. I think now's the right point in time to switch to English. Trends in the life science sector. Why did we choose that? Because as lawyers, we see a lot of, by the questions that we get from our clients, we see where things are going because they ask us a lot earlier before they start implementing changes. So we get to see what's coming around the corner. We see a lot of reports and statistics also, and there's a lot of interesting things that are coming our way. Or not.
Anita? Nein, kannst du weiter? Nein, drücken.
Sorry.
No problem. I will wait for you.
Thanks. So of course, through the nobody can hear the word anymore, COVID-19 pandemic, but still it's been a catalyst for change and for innovation. Even though it has been, of course, very hard on a lot of companies and people, it has also, as I said, been a catalyst for change, which is also something, if we want to take something positive out of the whole pandemic, then I think this would be it. One of the biggest changes, or where it's made change quicker, is digital innovation in the healthcare sector. We have seen through the COVID-19 pandemic how important it is to be digitalized in health, through things like the electronic patient file, through e-medication, e-prescriptions, which will be hopefully coming soon, etc., etc. In things like pandemics, of course, that really helps to keep the health system going. So it's important to keep these innovations going. That's also, of course, it's not only a technical issue, it's also a legal issue, because of course that any of those things I just spoke about, it's also about data collection. Those are very personal health, it's very personal health data that's being collected. So it's also correct, and it should be our aim to be very careful with all of the information the state gets through these things. But at the same time, we shouldn't forget that each patient and also each healthcare professional working in the health industry, that is the future. And it's very important that we go down that route with the right amount of legal structure around to make it possible. In Germany, they have come a bit further. They're a step ahead. In a lot of digital things, Germany is actually not a step ahead because they're a lot more careful in regard to data security. But where they have gone one step ahead is this so-called Digital Healthcare Act, which is something I hope, or also lots of people in the industry hope, will also be coming in Austria in some sort of way, because one of the core points of the Digital Healthcare Act in Germany is to fund e-health applications that help patients either communicate with their healthcare professionals, to usually also a lot of digital healthcare in patient compliance, making it easier for patients to correctly use their medication, and to keep in line with their healthcare. And the Digital Health Act in Germany has provisions that this can be reimbursed by the state, so that actually doctors can prescribe e-health applications, which makes a lot of sense in a lot of areas. That would be great if that would come to Austria, because not only does that help patients also to access these apps that usually cost money, of course, because it also costs money to develop them, but also it attracts investors, because then you have a business case that is attractive, because there's also the state paying for it. So that's something that will increase interest in this area and make more e-health applications possible, which is great for the patient, for healthcare professionals, and for health in the whole. And through the pandemic, things have changed. There's more digital interaction between patients and the healthcare professionals. It's often the first step a patient will go. They will Google what they have, which most healthcare professionals don't like, but it's something that we will have to get used to. So that's the way patients often first get the information. They look at which doctors there are online. They have a look, are they those good doctors or not? They look at what's been said about them. Then there's online appointments. So the next step is really to go into digital interaction between patients and the healthcare professionals to make it more easier for patients to go to their doctors, and to make it as easy as possible, because at the moment what we're seeing is also through the pandemic, this is the negative side, people have stopped going to their doctors. It's become less regular, and that will have a long-term effect on the whole healthcare system. There's research from Boston Consulting did some research and some studies at the end of 2021 to this whole theme, and spoke to healthcare providers, and what came was up to 60% of patient interactions for primary care will be conducted virtually in 3 to 5 years, is what they came up with in the research. So a huge amount of what's going to be happening in primary care will turn to virtual, which also means that healthcare professionals will have to change the way they work. They will have to make digital part of the way they understand medicine in future. This is the statistic which I was just talking about, where you can see in what areas they think that more virtual contact will take place, up to 60% in the next 3 to 5 years, which is a huge change of the health landscape. Next, please. Patient care nearby. This is something that we're seeing a lot of. Patients, it used to be that patients went to, they came out of hospital and they went back to hospital if they had questions, if they needed something. They were willing to go there to sit for hours until it was their turn with the doctor. Patients, especially due to also the pandemic, and also, of course, being scared of going into hospitals again, and it being also very difficult, have decided to stay home more. And this from home means also that companies, big pharma especially, has had to adapt and to go more to the patients and to their homes, either virtually, but also by sending nursing staff to people at home to see if how they're doing with their medication, to see how compliance is going, etc. Also here, e-health applications would help a lot, because then you can start monitoring compliance, for example, by way of an app, which would be helpful for everybody. Telemedicine under law, that's a bit of a problem in the whole of Europe. You can see it as a positive or a negative, depending on how you see things, I suppose. in Austria, telemedicine and lots of other European countries as well, is not regulated under law. There's no structure for it. On the one hand, there are companies that think that's terrific because you can do whatever you want and there's no rules in place. On the other hand, the rules we do have, of course, don't really fit to telemedicine, which makes it difficult. What it actually does is it transfers responsibility to every doctor and healthcare professional out there, saying you have to know, do you need to see that patient personally, or is it okay just to do it by Zoom, for example? So it puts a lot of responsibility onto each individual, which is maybe not the best case, because I think these days, or it's always been the case, but now even more healthcare professionals already have a lot of pressure and responsibility. So maybe it's a good idea to give them some rules that aren't too inflexible, but to have rules in place in order for them to know what's okay and what may I do, what can I do without having a liability at the end of the day. So I think, and there's European countries, for example, France, that have started to go down that route and to regulate that a little more to create a safe framework and conditions. I think it's important that we go down that route. I think there's a lot that could be done via Zoom, for example, before you go to hospital, that you have your doctor's appointments, for example, with the questions they have to go through, which is also a liability issue, to do that per Zoom or Teams. That would save a lot of time for both the patient and healthcare professional. There's not 100 people waiting in hospitals all the time. So there's a lot of things on that you could do more easily then. And I think that is something that will be coming up more and more in the future. Science and technology are booming. Yes, that is also something we've seen. I think what the population has seen, and which has been very important, is that there's a lot going on out there that they don't always know about. There's a lot of research and development. mRNA has been a huge plus for the industry, seeing what can be possible in a very short time. And especially what it showed is if you put enough money into a problem. You could most probably cure a lot of cancer or do a lot of things against a lot of illnesses out there if there would be the willingness to put that much money in it, like we did in the COVID pandemic. So I think that's very important. We've also seen a huge interest from investors, of course, especially in the biotech area and in e-health applications, because everybody thinks that's the way to go and that's what's going to be the future of medicine. So there's a lot of money going in, and that's very important. We shouldn't forget, especially in Austria, it's comparatively easy to start or to establish a startup in Austria. And you've got funds for the beginning, and they're great, and that works well. And then there's a long time until you get an investor interested enough to put money into your business. And that's something that we might need to develop more and have more interest in the midterm section, because what startups are unfortunately having to do is look for money all the time instead of having time to research and putting all their knowledge and time into that. So I think there's still some things that we can do here, but science and technology has gotten a huge push through the pandemic, and I think that's really important and great. It has put a focus on healthcare, which will be good for all of us. Future health professions, also here, I've said it beforehand, the health workforce is under high pressure. About 9,000 nurses say that they want to quit nursing. We have a huge amount. We would need more, even if those 9,000 stay, we still need a lot more. So we will need to refocus. We will need to keep people in health professions. We will need to pay them more, and we will need to give them more respect than they have had up till now. These are really, really hard jobs, and they cannot be, we can't digitalize those. So there's lots of things that we can help them with in administration. I think that would be great to get, digitalization of administrative work put into place so that they can really focus on their jobs instead of signing 100 papers, which they all don't like. I think that's very important. The city of Vienna is putting over €1 billion into this project. We'll see how well that works, but I think that's important to keep a focus on that. We really need also people in the health industry, because otherwise it won't work. And I think things like e-health applications and digitalization can support them. Transparency. People have become more interested in where they get their things and the way things work. And it's not just what they eat or the clothes they're wearing, but also where the medication that they're taking is actually being produced and by whom. And I think that was also one of the interesting things that came out of the pandemic, was that people understood that due to the fact that we're not paying a lot for a lot of medicines, the ones that we take all the time, like antibiotics, that they're being produced in China and India, and that if there's a pandemic and we don't have any supply chain, that we in Europe are going to start to have problems resourcing the medication that we need. So that's something important. The European Supply Chain Act is coming, where a lot of these things will become more transparent. I think that's also important for each and every consumer to understand. It might be important to pay a little bit more for the things you have, but then you also have security that in a global crisis, you still can take antibiotics when you need them. And last, but I think this is the last point, health equity as a priority. This is also something we've seen through the pandemic. On the one side, it's the difference between poor and rich, and that's, it sounds melodramatic, we're rich and we're in a very rich country, and that you might think it doesn't make a difference, but interestingly enough, there's statistics to this. And the difference between being born and living in the 1st district and in the 20th district is for men 5 years in life expectancy, and for women 4 years. So just the district in Vienna that you grew up in, and we're talking about a rich country, so you can imagine what it's like somewhere else, makes a huge difference in your life expectancy. Because will you be going to doctors? Do you have healthcare around the corner? Do you have the best doctors at hand? Can you maybe pay for private doctors, etc., etc., etc.? So it makes a huge difference. So we need to also have a look at health equity and how that works out, even in a rich country and even with the social security we have. And also, of course, this is always also a topic, equity between men and women in health. Still, we all know clinical trials are usually very male dominated. There's a lot of reasons for that, but that also leads to medication being not properly tested and adjusted for women. Leads to a lot of problems. Same thing is also in diagnostics for illnesses. The difference between a male heart attack and a female heart attack and the way it's is totally different. You have different symptoms, which often makes it difficult for doctors to find out what's wrong with you, because that's not what they're looking for. Yeah, that's me. That rounds that off and comes to an end. Those are the biggest trends that we see in what we're doing every day. Yeah, and I think afterwards there's time for some questions if anybody has any. Yes.